Well, the time has finally come for a group of doctors who have brought on a case against BC Public Health Officer Dr. Bonnie Henry's lingering vaccine mandates against healthcare workers. I'm Drea Humphrey with Rebel News, reporting to you on what happened in day 1 of 10 of the judicial review against just that.
What really stood out for me today, in fact, was the justice. And we were here 1 year ago for a case management conference since both sides were so far apart. And the difference is that 1 year ago, the judge was surprised at why we were there and a little bit disinterested, I would say, on the whole. I think 1 year later, the judge is involved.
Like I said, it's day 1 of what is expected to be 10 hearing dates for a judicial review brought on by the Canadian Society for Science and Ethics in Medicine. It's a group of doctors and other healthcare professionals who are challenging whether or not it's reasonable for the lingering vaccine mandate against healthcare workers to continue. That's right, there are still thousands of healthcare workers in BC, and who knows how many more that have retired or left to go somewhere else that are still being prohibited from saving lives in certain health settings. It's one of the only jurisdictions in the world still hanging on to this discriminatory vaccine mandate, and representing the society is a full team of legal counsels, but the one who gave submissions today was lawyer Peter Gall. He took a very consistent approach of submitting what was written inside of the healthcare mandate that was released in November 2021 till now, and comparing that with statements Dr. Bonnie Henry had said in different press releases that contradicted that. He talked about why on earth we're still doing vaccine mandates when someone who was vaccinated 2 years ago with 2 vaccines can still give COVID to someone else. He also pointed out a statement that Dr. Bonnie Henry said that many healthcare workers have found offensive.
First, we need to give everybody the opportunity to be immunized. That is really important in healthcare, and I have very little patience for people who aren't immunized in healthcare, and that will be, we've had a vaccinator mask policy for influenza. We will have a very similar policy that if people choose not to be immunized and you work in healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that decision.
Now, I did live tweet during the hearing to give you sort of play-by-play by what was said, and you can find that in the description box if you click on the link for this written article below. But right now, I want to jump to some of the healthcare workers who just left the building, including Dr. York Shung, a former vascular surgeon who is one of who knows how many who have retired instead of taking part in the coercive jab mandate. All right, Dr. Shung, thanks for being back on Rebel News.
Thank you very much for having me back on.
Now, you are one of the petitioners in this case. Tell us why it's so important for British Columbians to pay attention to what's happening this week.
Wow, this is super important because we've been under these mandates since 2021. Thousands of British Columbian healthcare workers, the best of the healthcare workers, they've lost their jobs. In addition to that, a whole bunch more took early retirement. And Bonnie Henry just keeps on continuing, with these mandates. So, we filed this petition for judicial review to review the reasonableness of still calling this an emergency, which allows her to have these emergency powers, and still saying that unvaccinated healthcare workers can't come back to work, despite knowing that the entire healthcare system is in crisis.
Well, as Mr. Gall, the attorney, said, there's approximately 2,000 healthcare workers unvaccinated who currently aren't working in BC, and probably underestimated because there are probably people who retired early or just left the profession or doing something else completely altogether rather than what they are trained to do and were doing before the vaccine mandate that aren't helping British Columbians with their health. So it's a very important case for the whole province, really.
Well, I am a registered psych nurse. I'm still registered, but I haven't been able to work since the mandates. So this was very important for me because this really affected my entire life. Like for the last 2.5 years, I've lost track of time really, but I just, my life has been topsy-turvy. Yeah. You know, it's gone to the point where I can't keep a roof over my head, you know, and just the mental torture, it's affected my mental health, right? I mean, just every aspect of my life. And I know there's a lot of other healthcare workers that are going through the same thing.
Well, one of the things that stood out to me in today's proceedings was a comment that we've shared before, but it's important to bring it up again, which is Dr. Bonnie Henry basically saying she doesn't really have much tolerance for unvaccinated healthcare workers. What do you make of hearing the public health officer say something like that?
I think it's a personal comment. I don't know why she dislikes them so much. You know, clearly that is her opinion of the healthcare workers. I don't know if she has practiced as a physician looking after individual patients. And I think a lot happens when that happens. You know, you treat patients. Most get better, some do not. You have families to look after. But to actually come out with a statement saying that if you're in healthcare and you don't take the vaccine, then you're in the wrong profession, I think that is, quite honestly, a very selfish type of attitude, and I think it's completely unjustified.
Well, you know, it's if we cast our minds back to 2020 when we were all cheering healthcare workers and emergency workers at 7 p.m. by banging our pots and pans and really honoring them for their hard work and sacrifice and putting themselves on the line. And then those same folks went from hero to zero with the mandate. And those people could rightly have said that many of them got and caught COVID and put themselves at risk and their families at risk by working and doing their job when it was very difficult. And they were achieving natural immunity. And naturally, that's going to be usually advantageous to protect that healthcare worker from future COVID. But that wasn't even a possibility of as a reason to not get the vaccine. And that probably was one reason that many healthcare workers did cite for their personal reasons for not wanting the COVID-19 vaccine when it came out, was that they had natural immunity from previous infection from work. Right? So that's actually a very, very scientific and reasonable statement. And we're not even talking religious exemptions here or vaccine injuries here, but is it necessary if I have natural immunity? And natural immunity is always going to be stronger than typically vaccine immunity. We're always trying to mimic and induce natural immunity. That's what vaccines do and work.
It's very disheartening, and it makes no sense because we, you know, like, and to label us as anti-vaxxers, you know, when, you know, all throughout, you know, we had to have vaccines to get into the nursing profession, and throughout, like, we've had, you know, to take various vaccines with, you know, and there was never been an issue, but this is a novel experiment that you're mandating, and we don't have the right to ask questions. So, you know, I think it was very unscientific, first of all, and her approach, and I just can't wrap my head around it, honestly.
What's one thing that stood out to you, whether it be from your counsel, Peter Gall, or even something that the Justice said today?
What really stood out for me today, in fact, was the Justice. And we were here 1 year ago for a case management conference, since both sides were so far apart. And the difference is that 1 year ago, the judge was surprised at why we were there and a little bit disinterested, I would say, on the whole. I think 1 year later, the judge is involved. He's interested. And I think that our lawyers have done a great job to try and simplify the case down to those two important issues. And so the first day is over, and I'm looking forward to day two.
Well, I think it was very interesting that Mr. Gall used public health's words and Dr. Bonnie Henry's words to back up many of his own submissions in the case. So, which is actually very interesting because on the one hand, they're saying, well, we're reducing the mandates because they're not as necessary anymore, so we're getting rid of mandates for masking and proximity, but we'll still keep the mandates for healthcare workers. So these conflicting arguments, or these conflicting statements from public health, it just goes to show you that it's not always really scientific what public health has been telling us this entire time.
But yeah, it doesn't really prevent anything. So why are we forcing this on people? You know, the mental health system is already under so much pressure, and to have nurses that are qualified that do want to work, but they can't because you have this nonsensical mandate still in place, it defies logic. And, you know, not to mention, you know, like they need to point out the fact that a lot of these nurses and healthcare professionals that were forced into taking the jab, who are now severely injured, getting sick all the time. So I don't understand why, you know, they're not looking into all the different ramifications of the mandates.
Rebel News has consistently brought you the other side of the COVID-19 story since the beginning, January 2020. If you appreciate that we haven't backed down from exposing medical tyranny and that we don't take a penny from the federal government to do so, please consider supporting the many costs involved to bring you reports just like this. A quick way to do so, and a fun way too, is to go to rebelnewsstore.com. It's getting close to Christmas. You can find something for the Patriot in your life or something for yourself, and everything you buy there goes to help keeping reports like this go strong. Again, that's rebelnewsstore.com. We appreciate your support.